The world of healthcare is changing faster than at any point in history. For centuries, medicine has been driven by human knowledge, intuition, and practice. But today, artificial intelligence is rewriting the rules. AI doesn't just assist doctors, it diagnoses diseases, predicts treatments, and even develops new drugs faster than any human team could. This is the story of AI-powered healthcare. A story of hope, fear, and the possibility of a world where machines play a bigger role in keeping us alive than human doctors. We begin with the basics. AI started as a tool for pattern recognition, scanning X-rays, detecting anomalies, and comparing images faster than a radiologist could. But soon, AI advanced. It began predicting outcomes, suggesting treatments, and finding hidden signals in genetic codes. AI can detect cancer cells earlier than many specialists. It can predict heart disease before symptoms show. It can spot rare conditions by analyzing millions of records. Where doctors see one patient at a time, AI sees millions of patterns in seconds. The old way of developing drugs takes years, even decades. AI now simulates molecules, predicts their behavior, and finds treatments at record speed. During the COVID-19 pandemic, AI helped researchers test vaccine models in weeks instead of years. With AI, healthcare shifts from one-size-fits-all to fully personalized treatment. By studying your DNA, habits, and lifestyle, AI designs unique plans tailored to your body. AI doesn't just live in computers, it lives in robots. Surgical robots can perform precise operations, guided by AI models that reduce human error. In some hospitals, robots deliver medicines, assist with nursing, and manage logistics. But with all this progress comes fear. Will AI replace doctors? Will healthcare decisions be trusted to machines instead of humans? What about privacy when your DNA is stored in AI databases? These are not small questions. They go to the heart of what it means to trust medicine. A machine can detect disease, but can it comfort a patient? Can it understand suffering? Can it offer empathy? Medicine is more than science. It is human care. AI may be powerful, but it cannot replace the human touch. Imagine a world where your phone detects illness before you even feel sick, where AI hospitals run 24/7 with zero downtime, where treatments are perfectly tailored to your body, extending human lifespan dramatically. AI in healthcare is not about replacing doctors. It's about creating a partnership. Machines provide the data, the speed, the analysis. Humans provide the care, the judgment, the empathy. Together, they may create the healthiest society in human history. But only if we learn how to balance progress with responsibility. Before we look forward, let's look back. Every leap in medical technology was once feared. Stethoscopes were once mocked as unnecessary gadgets. X-rays were considered unsafe. Even vaccines were doubted. Yet each one became essential. AI is simply the next great leap, but one that feels more radical because it threatens not just tools, but roles. In hospitals across the world, AI has already saved lives. One case involved a woman whose breast cancer went undetected by doctors. An AI scan caught the early signs. Treatment began immediately, saving her life. Studies now show that AI reduces misdiagnoses by significant percentages. This is no longer theory, it is real, and it is saving lives today. Millions live far from hospitals, in rural or underserved areas. AI promises mobile clinics powered by smart devices. Imagine an iPhone skin diagnosing pneumonia in seconds, or a portable AI lab detecting malaria in the middle of a village. AI healthcare could be the greatest equalizer in global medicine. Seconds matter in emergencies. In trauma units, AI analyzes patient vitals, predicts internal bleeding, and alerts doctors before symptoms show. In ambulances, AI can guide paramedics with life-saving decisions before patients reach the hospital. Lives are saved in those critical minutes. AI doesn't just treat disease, it prevents it. Wearable devices monitor heart rate, sleep, glucose, and oxygen around the clock. Algorithms detect subtle patterns of decline and warn you before illness begins. Preventing disease may soon be more important than curing it. The mind is harder to diagnose than the body. Yet AI chatbots now provide early mental health support, detect signs of depression, and even predict suicide risk from subtle changes in speech or social media posts. While controversial, it could open a door to saving countless lives. China, the US, and Europe are racing to dominate AI healthcare. China invests billions in AI hospitals. The US leads in private innovation. Europe focuses on ethics. The result is a global competition where the winners may shape how healthcare works for the entire planet. AI healthcare is not only science, it is big business. Tech companies partner with hospitals, selling algorithms, data platforms, and cloud services. Critics warn of profit-driven medicine, where algorithms may be designed to serve corporations before patients. As populations age, AI offers solutions. Robots remind seniors to take medicine, monitor for falls, and provide companionship. AI-powered assistants reduce loneliness, one of the most silent killers of old age. But there is danger. What happens if doctors lose skills because they depend too much on machines? Will new generations of doctors rely on algorithms instead of judgment? And what if the AI makes a mistake? Who is responsible? Your DNA is the most personal data you have. AI healthcare depends on analyzing billions of DNA sequences. Who owns that data? Who profits from it? Could it be hacked, sold, or misused? Healthcare privacy battles are just beginning. Imagine walking into a hospital where check-in is instant through facial recognition. AI triages patients, assigning priority based on vital scans. Robots deliver drugs. AI surgeons operate with human oversight. Doctors spend less time on paperwork, more on care. This is the hospital of the future. Medical schools are already changing. Students train with AI tutors, practice surgery in VR, and get real-time feedback from machine learning models. Tomorrow's doctors will be AI native, fluent in both medicine and algorithms. For the first time in history, AI may extend average human lifespan dramatically. By detecting disease early, personalizing treatment, and preventing illness, lifespans could increase by decades. But will this be available to all, or only the wealthy? If AI keeps us alive longer, what happens to the meaning of life? Will living to 120 be normal? Will humanity become too dependent on machines to survive? These questions are as important as the technology itself. AI in healthcare is both inspiring and terrifying. On one hand, it promises a world without many diseases. On the other, it raises fears of dehumanized care, surveillance, and inequality. Humanity stands at a crossroads. In the end, the rise of AI-powered healthcare is not about machines replacing doctors. It is about machines and doctors working together, each doing what they do best. The human doctor brings care, judgment, and empathy. The AI brings speed, data, and precision. Together, they can build a new era of medicine. But the balance must be carefully maintained because the stakes could not be higher. Nothing less than human life itself.